Welcome back. My first guest is Dr. Ari, who is an oncology physician who is basically a cancer specialist.
That's correct.
Welcome.
Thank you.
Tonight we're going to talk lung cancer. And Kentucky is a pretty big state for lung cancer.
Yeah, we rank #1 in both incidence of lung cancer, and it's because our smoking rates are fairly high in the state. And when we look at what causes lung cancer, 90% of lung cancers are caused by smoking. And so that invariably results in us being ranked #1 in cancer, both incidence and deaths related to lung cancer, unfortunately.
Now, smoking affects everything. It affects heart disease, and
Exactly.
It affects blood pressure, asthma, and a biggie for lung cancer. But there's other things that are risk factors for lung.
Yes, a lot of times patients ask me if something else caused their cancer, and there are things like radon exposure to radiation, especially patients that were treated for Hodgkin's disease as a young adult with radiation. That affects risk of lung cancer pretty high. Asbestos exposure, you don't see that as much anymore because there's fairly strict guidelines against it, but those are the major ones for the most part. We see a lot more cancer-related, smoking-related lung cancer than other ones, unfortunately.
And secondhand smoke is just as bad, or is it just as bad as smoking yourself?
It is. It's hard to quantify the amount of secondhand smoke somebody would get during their lifetime. We know exactly how many packs of cigarettes people smoke, but it's hard to quantify that. So that's a little more trickier option to detail, but it does have a significant risk, especially people who work in areas where there's no escape from the smoke. In the old days, the bars were a frequent issue. Airplane rides where smoking was allowed in the past. I think those were big risks at that time.
Well, now, what are some symptoms that would think, maybe I've got a lung problem I need to get looked at?
Well, obviously, infections and lung cancer can mimic each other, and so anything that presents as a cough could easily be an infection, but lung cancer is there as a risk factor, that especially if you're a long-time smoker. People with greater than 30 pack years, what that means is if you smoked a pack a day for 30 years, that's 30 pack years. If you smoke 2 packs per day for 15 years, again, 30 pack years. And so those people have increased risk. But unexplained weight loss, cough, when you cough, if you have blood associated with that, bone pain that doesn't get better. Cancer doesn't get better on its own. Other things do. And so if you give 2 weeks and things are not getting better, it's time to look a little more closely about why it's happening.
And I guess that's the real key, because if you've got a cough, especially this time of year, it could be allergy or infection.
Exactly.
And it's probably not lung cancer, but a cough that doesn't go away, you probably ought to get checked out.
Exactly. And usually a closer relationship with your primary care physician is important for that, because they know you, they know what your lifestyles are, they understand what's going on behind the scenes, so to speak, and so they can pick up on cues like that. That's a little different from usual.
Are there different types of lung cancers?
There is. I usually tell patients when they come in, there's 2 types essentially. One is called small cell, and the other one is not small cell or non-small cell. The small cell variety is almost exclusively associated with smoking, whereas the non-small cell is a small percentage that's not associated with smoking. We're seeing a lot more incidence of the non-small cell variety, which is adenocarcinoma, a little more increase in that. It's unclear why that's happening, but you see that a little bit rise in it. The treatments are very different, and so it's important to understand what those are. And the treatments are geared specifically to each subtype. If you saw me 10 years ago, I would treat non-smalls essentially the same, but today in 2013, we like to know exactly what type it is so we can gear treatment specifically to that subtype of cancer.
So you essentially target your treatment to the specific type of lung cancer, and you use predominantly chemotherapy.
Unfortunately, when I see the patient as an oncologist, it's invariably not a surgical disease or a curable disease for that matter. and that's about 75% of the patients who present with cancer, with lung cancer. And in that sense, chemotherapy is the option to extend life, but also to maybe solve some of the problems like pain and things like that, which we call palliative care.
Well, you mentioned palliative care. A lot of people have, whether it be lung cancer or any type of cancer, now could actually be considered a chronic disease, can live a long time with a cancer, and it's just like you manage your blood pressure, you have to manage the cancer.
That's true with certain cancer. Lung cancer, unfortunately, hasn't had that kind of outcomes. It's still, in majority of patients, we can extend life significantly, but not to the point where it's become a chronic illness anymore.
Is there any way to prevent lung cancer other than avoiding the risk factors?
Prevention is difficult because we know what causes it for the most part in 90% of patients, which is smoking. And so avoiding that risk factor makes a big difference. But other things that can mitigate the risk of getting lung cancer is really catching it early would be the key. So understanding yourself and your body and understanding what the symptoms you're presenting with and early detection is probably the key to that.
Does that mean everybody ought to have a chest x-ray?
We did that trial. It didn't really seem to help in that situation. When we look at high-risk patients, people who've had more than 30-year pack-year history of smoking, they did a low-dose CT scanner to look to see if it made a difference in picking up early cancers, and it did. But the trial is a little difficult because it looks at ages 55 to 74, and it only did 3 consecutive CT scans, so it picked up a lot more early-stage lung cancers, which is a time when it would be curable. But how long would you do that for and what the cost associated, still those are not things that we know for sure where that would land at the end of the day. But if you're 55 and you say every year you're going to get a low-dose CT scan, you're looking at a scan for the next 20 years. That's a lot of radiation also.
Right now, first of all, don't smoke.
Exactly.
But if you are a smoker and have a symptom, you probably ought to see your doctor and see
Don't
them early.
ignore it. I see a lot of people who present to me who've ignored the symptoms literally for a year or so. And in the back of my mind, I always, second guess myself. I wish they'd shown up a year ago. I wish they had picked up on it. And that's the key.
All right. Thanks for the information. Great information. We'll be right back.
Thank you.